Hey there, and welcome to This Explainer. I'm absolutely thrilled to be your guide today. Whether you're a dedicated pet owner, a shelter volunteer, or maybe an aspiring vet tech, today is all about mastering the core skills laid out in Unit Standard 31503 for companion animal examinations. We're going to learn exactly how to perform a comprehensive, head-to-tail physical exam on animals ranging from cats and dogs to rabbits and rodents. By the end of this, you're going to have the structured, systematic knowledge you need to become the ultimate health advocate for the animals in your care.
Okay, let's dive right into this. How do you actually identify hidden distress in an animal that literally cannot speak for itself? I mean, they can't exactly tell you where it hurts, right? And what's crazy is some species are actually hardwired by evolution to hide their pain from you entirely. It takes a sharp eye, a steady hand, and a highly structured approach to uncover those secret signs of illness before they turn into life-threatening emergencies. So here is our detective's roadmap for today. Number 1, the distance observation. Number 2, the systematic hands-on exam. Number 3, decoding lumps and lesions. Number 4, species-specific secret signs. And finally, number 5, vitals and emergency red flags. Let's get into it. Section 1, the distance observation. Think of yourself as a detective arriving at a crime scene. You wouldn't just go stomping through the evidence, right? So before you ever lay a single finger on an animal, you need to observe their natural gait, their posture, and their breathing from a distance, just to establish a healthy baseline. If you move straight to handling them, it can totally stress them out, which elevates their heart and respiratory rates, and it gives you completely false vitals. In veterinary medicine, the absolute gold standard is checking if the animal is BAR, bright, alert, and responsive. Basically, are they reacting normally to their environment? A lack of this, like maybe they look unusually drowsy, depressed, or if it's a prey animal, they have this glazed, staring expression. Well, that can mean an underlying toxic illness, a brain injury, or severe systemic distress. Now, once we've observed our patient from a distance, we do have to transition to actual contact. But here is the golden rule for our physical evaluation. If you always follow the same order, you will never miss a hidden wound. Being professional requires a structured, repeatable methodology. When you do it the exact same way every single time, you guarantee that no cell swelling, joint issue, or hidden lesion slips past you. Section 2, the systematic hands-on exam. Let's move on and see how this builds. This is where we break out our physical evaluation checklist and flow methodically from the tip of the nose all the way to the tip of the tail. Step 1 focuses purely on the head and neck. Step 2 covers the chest and abdomen. And Step 3 evaluates the limbs and the skin. Following this nose-to-tail flow ensures that absolutely no organ system gets overlooked. Starting right at the head, you'll want to gently lift the lip to examine the oral cavity. What you're looking at here is the mucous membrane color. You want to see a nice, healthy pink. You're also checking those teeth for tartar buildup, gingivitis, or any obvious fractures. Oh, and you'll want to press briefly on the gums to ensure the capillary refill time is under 2 seconds. Continuing with the head, you need to closely inspect the nose and eyes. You're actively hunting for any abnormal crusty or runny discharge or unusual redness. It's also super important to check for symmetry. Are the pupils the exact same size? Is there any cloudiness in the lens? Generally speaking, a healthy nose should be moist and clean, and both eyes should be bright and clear. As we move down the body, we complete the rest of our assessment. You're going to gently palpate the neck to feel for any lymph node enlargement. Next, you'll use a stethoscope to listen to the chest, checking that the heart has a regular rhythm and the lungs sound clear. Then, you'll gently feel the abdomen for any abnormal swellings or signs of pain. And finally, you'll manipulate the limbs, checking for joint swelling, heat, or restricted mobility that could point to arthritis or a localized injury. Section 3, decoding lumps and lesions. So during all this palpation, you're inevitably going to feel some skin abnormalities. And it's really not enough to just say, hey, I found a bump. Based on Unit Standard 31503, you actually need to understand the difference between primary and secondary lesions to decode what's going on. Primary lesions are the direct result of a disease. For instance, a pustule, which is just a small elevation containing pus, usually points to an active infection. A nodule is a solid mass that might be a growth. Secondary lesions, on the other hand, are the result of chronicity or the animal traumatizing itself. If they've been constantly scratching, you might see crusts of dried blood, or what's called lichenification, which basically looks like thick, tough elephant skin. Now, what's really interesting here is the vast visual difference between findings. On one side, you might find a small, localized bump, maybe just a minor cyst or a tiny nodule. But on the flip side, you could encounter a massive, deeply concerning swelling.
Differentiating these is absolutely vital because it tells a vet whether the animal just needs a quick round of antibiotics or an urgent biopsy for a major tumor.
And hey, we can't forget the coat itself. You must thoroughly inspect that fur, parting it all the way down to the skin. You're looking for obvious injuries, dermatitis, bald patches, and external parasites like fleas, ticks, or lice. You also want to keep an eye out for issues like mange. These parasites cause intense, severe distress and itching, which leads directly to those secondary skin lesions we were just talking about.
Section 4. Species-specific secret signs. Now, your expertise actually needs to adapt depending on exactly who is sitting on that exam cable. Predators, like dogs and cats, and prey species, like rabbits and rodents, display their symptoms in wildly different ways. It's fascinating, really. A dog in intense abdominal pain will often adopt a prayer position, stretching its chest to the floor with its hindquarters up in the air just to relieve the pressure. Cats might just go hide under the bed or refuse to jump up on things. But a rabbit? Their instinct is to mask pain entirely so they don't look like an easy meal to predators. They might exhibit conservation withdrawal, where they sit totally immobile and calm on the outside, while they are literally in agony on the inside.
For rabbits specifically, one of the most critical secret signs you can look for is bruxism, which is a really loud teeth grinding. Now, do not confuse this with the gentle teeth purring they do when they're happy and getting pets. Loud grinding is a severe indicator of pain. If a rabbit is doing this, especially if they aren't producing any droppings or are refusing food, they are almost certainly hiding a serious, life-threatening issue like gastrointestinal stasis.
Another huge red flag across multiple species, but especially in rabbits and rodents, is a hunched posture. You can actually see the slight unnatural increase in the arch of the back. While it's a bit nonspecific, it's an incredibly clear indicator of either significant abdominal pain or severe respiratory distress. Basically, the animal is actively trying to guard its internal organs and ease its discomfort.
Section 5. Vitals and emergency red flags.
Okay, we've observed, we've palpated, and we've decoded. Now we assess vitals so we know exactly when it's time to stop the exam and rush that animal to emergency care. Beyond the standard temperature, pulse, and respiration, hydration is a massive vital sign, and you can easily check this using the skin tent test. You just pull the loose skin over the animal's chest or back into a little tent shape and then let it go. In a healthy, well-hydrated animal, the skin snaps back instantly. If it returns slowly or just stays tented up, that animal is significantly dehydrated.
So the crucial point here is knowing when a minor observation turns into an absolute drop-everything emergency that needs a vet right now. If you see unproductive retching, especially in a deep-chested dog, you could be looking at bloat. Pale gums means shock and poor circulation. Straining to pee but nothing comes out, super common in male cats, that's a blockage. And of course, any sudden collapse, seizures, or severe breathing difficulties mean you stop what you're doing and you get that animal help immediately, no exceptions.
We've covered a lot today. We went over the distance observation, the head-to-tail methodology, decoding lesions, and those sneaky species-specific signs. The framework is completely in your hands now. So the next time you're looking at an animal in your care, ask yourself, will you catch the subtle clues before it's too late? By applying this highly structured methodology, you're not going to just be guessing anymore. You will be the ultimate health advocate they so desperately need. Thank you so much for joining me for this explainer, and keep learning.